In this video, you will get to know about some very expensive medicines in the world. So, without any further ado, let's get started. Number 1. Hemgenix. Cost: $3.5 million per dose. Manufactured by CSL Behring, used in the management of hemophilia. Hemophilia is a genetic disorder. Individuals suffering from this disease tend to bleed due to the absence of a clotting factor in the blood known as factor IX, because of the lack of genes that are involved in its production. Depending on the severity of the disease, it can range from mild hemophilia, in which there is prolonged bleeding, but only after surgery or dental procedure, such as tooth extraction, to severe hemophilia, in which there is frequent bleeding episodes in the muscles and joints. Now, how Hemgenix helps its patient is by allowing their liver to synthesize that missing factor IX that helps in blood clotting. This medicine is not some conventional medicine. In fact, it's based on gene therapy. Now, what this means is that this medicine provides the missing genes that are necessary in the production of clotting factor IX. The missing genes are carried by non-infectious viruses through the bloodstream and into the liver. The liver cells use those genes and produce clotting factor responsible for blood clotting. Number 2. Elevidys. Cost: $3.2 million per dose. Manufactured by Sarepta Therapeutics, used in the management of Duchene muscular dystrophy. DMD is very rare genetic disease. The patient of DMD suffers from muscular degeneration and weakness of the muscles later on as the disease progresses. The heart and respiratory muscles are also affected, which results in respiratory failure. Now, what happens in this disease is that there is a protein in the muscles known as dystrophin, which is responsible in keeping the muscle fibers intact and maintaining its overall strength. And because of the lack of genes or a mutation in those genes that are involved in the synthesis of dystrophin, there is very little to no production of dystrophin. As a result, muscles get weaker and weaker, and people suffering from it die as a result. Now, how does Elevidys help in the management of DMD? Elevidys is based on virus-based gene therapy. The gene necessary for the production of dystrophin is loaded into a non-infectious virus and administered into the body of the patient. The viral vector carries the gene to the target site, mainly the muscles, where it promotes the synthesis of dystrophin protein, improving the symptoms of DMD.
Number 3. Skysona. Cost: $3 million per dose. Manufactured by Bluebird Bio, used in the management of cerebral adrenoleukodystrophy. Cerebral adrenoleukodystrophy, or CLAD in short, is a genetic disorder characterized by the accumulation of long-chain fatty acids in the brain and spinal cord, leading to the destruction of the myelin sheath that surrounds the neurons, resulting in poor nerve impulse conduction by the neurons. Its symptoms are loss of voluntary movements, wheelchair dependency, and learning disabilities. Now, what happens in CLAD is that the enzyme known as ALDP, adrenoleukodystrophy protein, which is responsible for the breaking down of those long-chain fatty acids, is not produced due to the mutation in the ABCD1 gene. Now, how does Skysona work? Skysona consists of the patient's CD34 plus stem cells that are modified to contain a functional ABCD1 gene, the gene responsible for the production of the ALDP enzyme that breaks those long-chain fatty acids, helping in the management of CLAD.
So these were some of the most expensive medicines in the world. Subscribe for part 2. Hope you liked the video. Goodbye.